Hi, this video is about Independent Living Skills Survey ILSS. Introduction. The Independent Living Skills Survey ILSS is a standardized assessment of competence in IELTS and ADLs requiring the individuals to demonstrate problem-solving skills. It is composed of 5 sub-skills, which are memory or orientation, managing money, managing home and transportation, health and safety, and social adjustment. This assessment is being translated into French, Brazil, and the original language is English. Developer: Jenny Wallace, Robert Paul Lieberman, Charles J. Wallace, and Robert Tauber. Purpose: ILSS is to assess role functioning in the lifestyle relevant to the majority of individuals with severely and persistently mentally ill individuals, SPMI. Helps to identify individuals' level of independence in ADLs and IADLs by touching on item of area of independent living. Target population: individual with severe and persistent mental illness, psychotic patient, and schizophrenia. Contraindications: ILSS-I, invalid to be used in informant that has limited knowledge about the individual. For ILSS-SR, invalid to be used for individuals with no insight. There are 2 types of ILSS, which is informant questionnaire and self-report assessment. Component being assessed: ILSS-I. It consists of 103 items assess performance in 12 areas of basic community living skills. ILSS-SR. It consists of 70 items and are grouped into 10 areas. Administration procedure. For ILSS-I, rapid interview with regard to client. For example, interview the mother about the client. ILSS-I can be conveniently administered in person, by phone, or by mail. The time frame of the ILSS-I is during the past 30 days. Proxy needs to put only 1 check mark for each task.
Assalamualaikum, madam. Waalaikumsalam. I am Atira, an occupational therapist. So today I will conduct an assessment named Independent Living Skills Survey. So the purpose of this assessment is to assess the role functioning of lifestyle. Basically, this assessment consists of 103 items. So you can read the question and indicate how often your daughter perform each of the tasks during the past 30 days. Okay, you have to put only 1 check mark for each task, whether your daughter always, usually, often, sometimes, or never perform the task. If a task is never performed because there is no opportunity to do so, you can place a check mark on the no opportunity column. So if you have any difficulty in answering the question, you can ask me. Okay, so you can start now.
For ILSS-SR, therapist will ask each of the questions to the client by using the time frame followed by the task. The client has to respond either no or yes or not apply. For clients who have reading difficulties, therapist may read the questions to the client, and the client need to answer all of the questions.
Assalamualaikum, Miss. Okay, I am Atira, an occupational therapist. So today I will conduct an assessment named Independent Living Skills Survey. The purpose of this assessment is to assess your role functioning in lifestyle. So basically, this assessment contains of 70 items, and you need to answer all of the questions, although some of them may seem irrelevant. So you need to respond either no or yes. If the task is never performed because there is no opportunity to do so, you can answer not apply. So I will start now. Okay. So in the last 30 days, did you wash your clothes by hand or machine using the proper amount of detergent?
Yes.
Yes. Okay. So in the last 30 days, did you dry your clothes in a dryer or a clothes line?
Yes.
Administration time. ILSS take 20 to 30 minutes to complete. Scoring procedure. Scoring procedure for ILSS-I. The answer are scored from 0, which is never, 1 for sometimes, 2 for often, 3 for usually, and 4 for always. Item answer no opportunity are ignored. Then, sum the total score for each area. However, an area is not scored if 3 or fewer items are answered with other than no opportunity option. And don't forget to reverse the score for some questions that require reverse score. Then, sum the total score of all area and average per functional area. Scoring procedure ILSS-SR. The total answer are added 0 for no or 1 for yes, and the average per functional area except those items answered with not applied are ignored. An area is not scored if 3 or fewer items are answered with yes or no option. A response option not apply was added to identify individuals' living situations in the opportunities to perform a skill, and the task may not be done due to lack of environmental opportunity. Thus, therapists need to do a follow-up session to verify it. Interpretation. The higher the score, the better ability for an independent life. Psychometric properties. ILSS-I. The reliability, internal consistency. Internal reliability for the 9 subscale was mixed, ranging from 0.741 for the health maintenance subscale to 0.944 for the money management subscale. Alpha not calculated for the job maintenance subscale because there is only one item in this area. All the subscale had coefficient above 0.70. Test retest. The test retest coefficients range from 0.340 for the job maintenance subscale to 0.907 for the money management subscale. Iterator. All the subscale had coefficient below 0.70. ILSS-I. Validity. The phase validity. The French version of ILSS was administered to 14 patients with a psychotic diagnosis who were living in the community. Convergent. ILSS-I mean per functional area and overall score will correlate with BPRS, PALC, and GAS scores. The correlation were based on different sample size. The average sample size was 89.7 for the ILSS-I. Even though low, all correlations are in the expected direction and are consistent across the various areas of the ILSS, particularly for the ILSS-I. Concurrent. Of the 36 correlation between the 4 positive assets score of the NOSI-30, social competence, social interest, personal neatness, and total positive assets, and the 9 skill area of the ILSS-20 were significant at the 0.01 level and 4 at the 0.05 level. The two measures share from 10 to 37% of their variance in common. This was sufficient to prove evidence of the current validity of the ILSS and to indicate that it is not simply a variation of the NOSI-30. ILSS-SR. Reliability. Internal consistency. The ILSS-I version correlation are considerably higher and generally significant from brush alpha range 0.74 to 0.94 compared to the ILSS lower and generally non-significant correlation from brush alpha range 0.43 to 0.90. Test retest. The test retest coefficient for ILSS-SR ranging from 0.418 for leisure to 0.904 for job management. 46 patients of schizophrenia participate in the test retest with an ICC range from 0.84 to 0.94, strong to almost perfect strength or agreement, and kappa between negative 0.02 and 1.0. Iterator. For both ILSS-SR and ILSS-I, they had coefficient below than 0.70. ILSS-SR. Validity. The phase validity. In a study carried out by C.J. Wallace, the investigator assessed ILSS-SR to 205 patients with SPMI, and it has been found that this assessment has good psychometric properties. Convergent. The correlation tended to be low. ILSS-SR was correlated 0.38 with GAS and negative 0.32 with BPRS. Discriminant. The discriminant validity of the scale was verified by comparing male and female performance in the overall scale score in Brazilian version of ILSS. Female had higher score in 6 subscale and in the overall score. 5 of the 10 subscale made a statistically significant distinction between male and female. Predictive. The transformed ILSS-SR best predicted employability either alone or after the other variables had been entered into the stepwise analysis surpassing even work history. Remarks. ILSS-I. Advantages. Adequate internal consistency and interoperability, sensitive to changes associated with skill training, conveniently administered in person, by phone or by mail because completion requires only a brief oral or written explanation of the response skill. Various areas of occupation included in this assessment. Author is an expert in mental health care. Disadvantages. Tend to underestimate the patient's ability. Invalid to be used for the informant that has limited knowledge about the individual. Individuals may not be able to identify a suitable proxy. For example, Peterson and College 1996 found that as many as 2/3 of all the patients with schizophrenia were not able to name a caregiver who could provide a report on how they were functioning. For the ILSS-I, the informant who completed the questionnaire was not necessarily the same person from testing to testing. However, it will be good to interview the same informant, so the evaluation is from the same person's perspective. Suitability to be used with Malaysian population. ILSS-SR. The advantages is a comprehensive, objective, performance-focused, easy to administer measure of the basic functional living skill of individuals with severe and persistent mental illness. Number 2, a simpler version of the ILSS-I and suitable for administration in typically busy clinical setting. It can be administered during an individual routine visit to a practitioner and may provide opportunity for the practitioner to ask about significant events pertaining to the individual living environment. ILSS-SR and ILSS-I are generally reliable and stable and sensitive measure of basic functional living skills. Authors are an expert in mental health care. For disadvantages, client may be underestimate or overestimate his or her performance or capability. The individuals may have incomplete or inaccurate memories of their performance ability. No Malaysian, so it might be difficult for some Malaysians to understand the question. ILSS-SR suitability to be used with Malaysian population. Overall, questions stated are applicable and relevant for Malaysian population, but there are a few items which are not suitable, such as in money management item 4, transportation item 1, and leisure and community item 6. Besides, there is still no Malay version for this assessment. Thank you.